Good morning to those that have come into our Zoom, our very first virtual Board of Governors exam preparation series. So thank you for joining us. We're going to wait for more individuals to come in and join us and then start our program. So thank you.
Thank you. Good morning.
Good morning, everyone. And this is Stella. Nora, I want to say thank you for getting back to me via email about my next Saturday. I can't attend.
Oh, yeah, no worries.
Thank
and this
you.
is being recorded. So,
yeah, oh, that's lovely. So
yeah.
we will have the link.
Yes.
Yeah, that's great. Thank you.
So we'll just wait another minute or two. Thank you for joining us. And we have some more participants coming in through the wait room.
Okay, Sherry, it looks like it's slowed down in the waiting room.
Okay, thank you, Shauna. Well, we're very, very proud to be here. Our team, which is the Advancement Committee for the California Association of Healthcare Leaders, has been working on our virtual presentation for quite a few months, but very pleased to be able to present to you in this format. As we have all found, we're learning a lot about our Zoom skills, and we are learning about how to bring a review session like this into the virtual world. So your feedback will be very important. Our next slide is going to show us our team here. If you could advance, Nora. So I'll introduce myself and then I'll ask each of my team members to come off mute to introduce themselves. I'm Sherry Ambrose and I'm the co-chair with Nora of the Advancement Committee. And I am currently a full-time student. I've worked in the healthcare industry for 40 years. And I recently was at Dignity Health for 7 years as chief nurse and chief operating officer. So I'll pass it to Nora.
Hi, good morning all. I'm Nora Powers. I'm also co-chair of the committee. I've been a member of this committee for almost 8 years now. This is our first virtual, so I'm really excited. If any of you have attended any of our previous sessions, they used to be in person on site a whole day. But so now we've transitioned, so please bear with us if there's any technology issues. I'm currently a director of network management for Aetna. And prior to that, I was with Anthem Blue Cross for 9 years. So I used to be the token payer rep in our chapter, but now I believe there's someone else from Blue Cross Blue Shield, I believe. So as soon as I find that person, we will become the 2 token reps, payer reps in this chapter. So welcome. Look forward to working with you on this.
I'll hand it to Richard.
I wasn't going to unmute. Hi, I'm Rick Nerad, and I'm a member of the committee since, I don't know how long, it seems like forever. I was one of the founding board members of CAHL, so I've been hanging around various forms of CAHL for a long time. In my real life, I'm professor of health services administration at California State University, Chico, and I'm one of the 2 voices who you'll hear on the voiceover PowerPoints that we'll be sending out each week. Those were originally prepared as part of our university's College Bowl, Health Administration College Bowl team prep. So we run a class to prepare our students to win the College Bowl each year. And they worked real well for this because it's basically a Board of Governors prep class that we run every year.
I'll hand it to Shauna.
Yes, hello, welcome. I am Shauna Taylor, Director of Operations for Stanford Healthcare, and I will just be in the background helping with the technology.
Michael.
Hi, good morning, everyone. Welcome to this webinar series. And I'm Michael DeCoco. I have been in the healthcare field for 20 years, and I am the newest member of this committee. And I am currently the Director of Laboratory and Diagnostic Services at Madera Community Hospital. Thank you.
Wonderful, thanks all. So we'll do a little bit of housekeeping here. Again, we want to thank you for being early adapters with us with the new model. Shauna will be managing the chat room. We encourage the interactive processes in the chat room, either introducing yourselves through the chat room or questions. Shauna will gather questions. So we will keep you on mute and ask you to unmute at the end after the presenters. But we will have plenty of time at the end to answer questions or get those questions logged if we don't have the answers, and get those back to you for next week. You did receive your launch email. Thank you, Nora. Nora's done a tremendous job getting these together, pulling together the welcoming emails and then the information. So you will receive that each week. You'll receive one tonight or tomorrow with next week's voiceover. Thank you, Rick and company, for the voiceovers that you can review in between sessions, and you'll have those available to you. Again, at the end of today as well, you'll get our introduction PowerPoint, and you'll also get today's topic, which you received some study questions. And that's what we're really going to be focusing on, is giving you tools through this program. This program allows you to understand what all the options are for you to become successful with passing the Board of Governor exam. And it will also give you opportunities to look at topics that you're not as comfortable with and develop your study plan. And we'll talk more about that during our presentation today. And then finally, we are recording this event, and so that will be available to you. Team, did I miss anything?
Rick likes to remind us that, again, with any technology, we do expect, as he said, to see small humans or furry mammals make an appearance. And trust us, we actually appreciate seeing those, because it reminds us, you know, we're all in a new environment now. So we welcome, I mean, please don't be embarrassed if we see interruptions like that. We actually welcome them.
And then also, it's nice to see your face. If you are able to share that with us, that's important. So that way we have that interaction with individuals. I know sometimes there's logistics with cameras and so forth, but if we can, we ask that. And again, just to remind folks that we'll have you all muted until we get to the end with questions that we can have you unmute and then ask or we'll answer questions that have come through the chat room. So Nora, take it away.
Thank you, Sherry. Before we get started, another housekeeping piece. By no means do we intend to be your sole source of information for passing this exam. Again, as Sherry indicated, and what Rick has done a really good job with in presenting the voiceover PowerPoints, is we're giving you the broad areas to study. We will provide as many sample question documents as we have. There's a lot of information in the FACHE site of the ACHE site. And so what we're doing is trying to give you the foundations and the guidelines to follow for that. And with that, so I will start. Again, Shauna did a really good job of putting this page together to show, whoops, wrong. Oh, okay. to show that if you go to ACHE and into the FACHE site, there is a lot of information available there about how to, precisely what we're presenting here. So when I first started this journey, this was before websites, before you could do anything online. So this is absolutely fabulous. Later, when we get to some of the requirements, it talks about needing some references, and we'll talk about how you can use those of us on the committee here if you need references, as well as leaders within your own organization that can help. Okay, so eligibility requirements to apply for advancement and for sitting for the Board of Governance exam. What's interesting, initially, up through the rest of this year, you have to be a member of ACHE for 3 years before you qualify for advancement. Beginning on January 1, you only need 1 year with ACHE to be able to qualify to advance. You need an advanced degree, whether it's a master's or some other post-baccalaureate degree. Then you need at least 5 years of executive healthcare management experience. And there's an asterisk because ACHE has provided a decision matrix for you to, if you don't have the qualifications right up front, this helps you determine what you have and how you can use that to qualify. And this is what the document looks like. And we do have a committee that assists with career transitions, and the members of that committee have volunteered to be available to you if and when you need help with this. So you won't be on your own with this either. And I will be providing that contact information later. This came up primarily because originally ACHE had a very limited view or definition, meaning you actually had to have people report to you and you actually needed to run a department, you know, some sort of operational experience. Well, as our healthcare industry has expanded and ACHE now we have membership that has all kinds of positions and experience in the healthcare industry. This will help us determine, do you meet that requirement? So you also need 36 hours of healthcare management continuing education in the prior 3-year period, 12 of which must be ACHE face-to-face education credits. And the remaining can be either the face-to-face or the qualified education credits. And the difference between the two is, for example, this presentation we're doing right here qualifies for 7.5 hours of the qualified education credits. The face-to-face are the ones where you actually had to literally be in the same room face-to-face. And there are some webinars online that qualify for face-to-face. The key is ACHE will indicate whether they're face-to-face or qualified education credits. So that's the key. And you keep track of, you self-report your qualified education credits. And when you register for ACHE face-to-face sessions, ACHE will enter those credits for you. You can check those in your own system and confirm whether they're correct or not. You can contact ACHE if you have any questions or if you know for corrections. You have to have 2 examples of volunteer activities during the last 3 years because the college does believe we need to be well-rounded people, and rightfully so. We are members of our community. We are members of our profession. We are expected to give back to our community and to our professions. And the FACHE site will help give examples of what those could be. And for community, healthcare-related activities are relatively easy to determine. Being a volunteer on the CAHL, any of the CAHL committees, being volunteers with any of the ACHE or any within your organization. The community and civic activities, those can be almost anything that you're doing to give back to your community. If you have any questions, you can call ACHE, the Education Department of ACHE, and they will help walk you through that. And then last but not least are the 2 references from a fellow. At least one reference needs to be a structured interview, and the FACHE site includes the information around a structured interview. You need to request one from the person that you'd like to conduct the interview, and then it's a back and forth interaction. The college also likes you to seek for the second fellow. If it's not someone within your organization, they do ask if you reach out to someone within your organization to provide a reference for you. And this, what's interesting is for a lot of people that are applying, they don't even know anyone in their organization, or this is their first introduction into reaching out to someone within their organization. And there's a couple of ways you can find out through the member directory. You can search by fellows in your city, in your organization, and this is what this intent here is, for you to reach out to a fellow that is, again, within your circle, or someone that you can meet or already know. So you can complete and submit the application online, and this is the information that you need to attach with the application. So you do need to submit the job description, organizational chart, and resume. And you can use, again, you can use a documentation within the decision matrix tool to help define what your healthcare management experience is. If your job description doesn't quite address it, then you can add the information from the decision matrix tool. You need to provide your names of references, and then the ACHE will go out and contact your references as well as you to go out, and those can be submitted online. And then you provide the $250 application fee. Oh, I'm sorry, this was supposed to be Rick's section. I am so sorry, Rick. I'm gonna let you take over. Sorry.
Well, you did the hard part for me already, so this was good. I was just wondering, I was going to let you keep going. Let me just emphasize that last part about the periodic fee waivers, that ACHE does that annually, and I believe it's always in the spring, or at least it's usually there. And if you watch for that and then sign up to take the test, then the fee is waived, and anytime you can save $250, that's always good. So you then have until, I think, the end of the year to take it. So keep your eye open for that, and it's usually announced in various ways through ACHE, through emails, through CAHL. The test is taken at an exam site by Pearson VUE, and you get to pick your site. If you go in there, you sign up for a specific time, and then you wait for them to call you. My strong recommendation is empty your pockets in your car before you come in, or just bring your ID, picture ID, and leave everything else, because they will have you lock up everything that you bring in and prove that your pockets are empty. It's very secure in that sense. So it does make it easier. Take a look at the rules that they'll post on their website for what you have to do, and then it's easier if you familiarize yourself with those and follow them. You do have the option of taking the paper exam if you go to Chicago in the winter at the annual Congress, but you don't have to wait to them or travel. You can do it pretty locally. Next slide, please. I'm assuming by now everyone's taken a look at this, the core areas. So this is the area that you'll be aiming your preparation at, that we'll be covering over the next few weeks. Speaking of small things walking across the stage, sit down, Kat. The number of questions and the percentage of the questions does give an indication of the importance within the field. So you really can't get by with just saying, oh, I'll just study for the ones I know and I'll get by in the others. They will be spread out, and odds are you're going to get all the ones. Next slide. And the test itself will have 230 questions, but only 200 of them are scored. They'll have 30 test questions that they're trying out to see if people understand them, if they are getting the right answers. They go through the whole analysis of them and then determine which ones actually make it into the test the following year. And the goal here is that this is competency-based, so memorizing does help in some areas, but most of it, you've got to be able to apply stuff as well. You've got to understand it, not just memorize it. So there's not a lot of facts that they're asking you to memorize. And I will turn this over to, I forget who comes next.
I'll take a moment, Rick, before Michael starts with us. We're excited because each of these sessions, we have a guest, surprise guest. You won't know till we introduce them after we start. But this is an honor for us to have participants from other CAHL committees, other board members, and other long-term or individuals that have supported CAHL. So you get to meet them. So I am so excited to be able to introduce Arnaldo Silva, Cardiovascular Services Manager for UC Davis Medical Center, and he's a member of the CAHL Military Outreach Committee. So Arnaldo, please join us and introduce yourself.
Good morning, CAHL family. My name is Arnaldo Silva. As Sherry mentioned, I currently am the Cardiovascular Services Manager at UC Davis Medical Center, and it's an honor to be here. And first and foremost, I just want to thank the Advancement Committee for putting this together. I mean, in a time where everything is canceled and we still need to focus on our progression and education, this is vital. I took part in one of the Board of Governor exams review sessions approximately 18 months ago. Actually, it was my first week in California, and I took it as an opportunity to jump in there, get to meet some people, get to network, and I've been able to establish those relationships and maintain those relationships till this day. So, you know, like I said, it's an honor to be here. And I couldn't think of a better way to start our Saturday off than looking at bettering ourselves. I think a lot of times as leaders, we focus on our direct reports and people within our departments, but we need to think about investing in ourselves. So this couldn't be a better way to start off our Saturday, and I'm very looking forward to these next 5 sessions with the team. As Sherry mentioned, I'm part of the Military Outreach Committee. A little bit about my background: I am retired Air Force, so my healthcare experience started off in the military. A lot of my leadership foundation started off in the military. We have a lot of members today that are joining for this Board of Governors review prep from Travis Air Force Base. We have veterans, so thank you guys for your service. Thank you guys for joining us. It's a pleasure to have you, and it's an honor to provide this prep course for you guys as you guys get ready for the Board of Governors exam. And to everybody else, if you're interested in participating in the Military Outreach Committee, giving back to those veterans, spouses, active duty members, please feel free to reach out to me. I'm on LinkedIn. I'll be more than happy to connect you. We have monthly meetings. And on pretty much what we do is we reach out to the military community and assist them with their transition, whether they're getting ready to get out of the military or they've gotten out of the military and they're a little lost as far as where to go, how to navigate their career, or if they're currently in the military and they're just wanting to advance. We also assist them in that aspect as well. So just to wrap it up, I just want to say thank you to everybody. It's a pleasure to be here, and I couldn't think of a better place to be on a Saturday morning than to start off this Board of Governors exam review, and thank you to everybody.
Thank you so much, Arnaldo. So Michael, take it away.
Good morning, everyone. So next slide, please. So in this slide, I just want to highlight some of the ACHE helpful links that will guide you to your FACHE journey. So the first link is the live FACHE overview webinars. So whether you've determined now is the time for you to begin the process toward FACHE, or you're still deciding the next step to your journey, this link is helpful for you. So this webinar link is free for you to attend, but it requires registration. So there are two remaining schedules for 2020, which is on October 15th and on December 10th. The next link is the Board of Governors exam preparation resources. So if you have just begun studying or are in-depthly entrenched and need assistance, self-study resources link can help you prepare for the exam to earn your FACHE designation. The next link is the FAQC and reference list link. So the FAQ link has top 10 questions often asked by healthcare executives or leaders on their journey to FACHE Board of Governors examination. So feel free to just go to that link and you can see the question and answer in there. And the last on this link, on this slide link, is the link on the reference list link. It has the list of books that focus on various knowledge areas that are covered in the examination. Next slide, please. Next slide, please. Thank you, Nora. So these two are very helpful links. The first link is on the Board of Governors review course, ache.org or education. So the Board of Governors review course is an on-site review class held either in Chicago or Atlanta. It is a 2 days and a half course offered biannually. By attending this course, you will earn 19 ACHE face-to-face education units or credits and a $200 exam waiver. So you will have also the opportunity to learn directly from various authors of the reference books. But I believe these are canceled right now because of the pandemic situation. And the last link is the online tutorial, which is the ache.org exam online tutorial. The online tutorial is a convenient way to prepare for the examination. The tutorial uses an online self-study format to help refine your knowledge and improve your study skills. It provides a detailed look at the different topics covered in the examination. Through this online course, you will have access to PowerPoint, audio lectures, and various reading materials. You will also earn 6 ACHE qualified education units upon completion of the course. Personally, I have used these two resources during my preparation for the BOG examination, and I find it very helpful and I would say that it helped me pass my BOG examination. Next slide, I think next. Thank you.
I'll go ahead and take over. But first, before I do that, we have another guest that Shauna's going to introduce for us.
Yes, thank you. I did want to welcome Sechin. He is one of our recipients for the Early Careerist Healthcare Executive Award, and he is also a co-chair of one of our committees who is a board member. So I also wanted to welcome Sechin. Sechin, did you want to say a few words as well?
Sure. Can you hear me all right?
Yes, sorry.
Okay. Thank you, Nora, Sherry, and the entire team, including Shauna, for putting this together. I know this is a difficult time for a lot of our folks, especially the healthcare professionals. I think what we have been doing through our CAHL conference video series and our learning from leaders sessions is to use our virtual platform to deliver the same values of education that we've been doing that. I I own and manage a clinic here for my wife in Modesto called Valley Diabetes and Obesity. Started 4 years ago, and as soon as I started that clinic, I joined CAHL, and I have to say that that's one of the best decisions I've made in terms of just getting to know our healthcare in California, getting to network with all of our executives, and actually learning a lot of what's going on within the industry itself. I have been a part of the communications committee since the beginning, and this past year I joined the Congress initiative because I felt really strongly about the value we can bring for all of our California members. I truly appreciate the team's effort in putting this together, because one of our goals for CAHL is to help engage a lot more healthcare professionals and our members to pursue this fellowship. California is one of the leading chapters which has been successful in bringing out the value of FACHI and our sessions, especially online and through our innovative streaming services in the past. So I do appreciate, and I'm happy that I'm able to join today.
Awesome. Thank you, Sachin.
Thank you, Session.
Thank you.
So I think this can be one of the most important parts of learning from others that have either gone before you to take the exam or are in the process. And this is our test taking tips. And I am going to add, as well as we use this for Zoom. But most importantly is to use whatever tools you use, or this is a tool that I use. I use a heart math focused breathing technique, and we practiced that a little this morning before we started Zoom. And it's just about really getting yourself ready for the exam, your confidence up, and your clarity or your coherence. So we just emphasize, and one tip I use for heart math is just focus on the area around your heart and just imagine your breathing is coming in and out of your heart a little slower, a little deeper, and just practice that for just 5 seconds, 10 seconds. You can do it during the exam if you're either feeling somewhat overwhelmed, or if you're feeling tired and you want to bring yourself back. While you're studying, I find it brings in clarity as well. So important step for you as you go through this process. One of the things that I think Richard provided us with this particular tip, which I think is great, is when you read the exam options, is look at them as first true or false, because you know with these exams, there's techniques and there's strategies around that. And if the question's completely false, you know, that eliminate that as a selection. We can't emphasize enough during the exam to read and reread each question. You know, there could be one word in that question that is going to be the key. So taking your moments to read and reread, and you do have plenty of time. The last second to the last bullet point is you have up to 6 hours. So plan to take breaks, plan to keep yourself on a pace, and reread the questions so that you're taking that time for each question. Beware of those questions that state all of the above or all except. And also, you can mark questions for review. And I'll ask my team if they want to add anything else to this list.
Yes, Sherry, can I add something on the test taking tips? So this is Michael. The exam is more on a psychometric tests. So it's an analysis, not a recall. So it will ask you to apply your knowledge about healthcare knowledge to the current situation. So more on an application. So it's application exam.
The other one I'm going to add is a practical one, which is really make sure you're noticing when it says not or any other kind of negative. It's too easy to skip over those. And then you say, well, I've got 3 of them here. Which one is it? Well, obviously it's the 4th one, but you may not notice it.
We've seen requests in the chat room about getting this presentation. Absolutely. You will receive this. It will include the links. It will include this so that you can review it. And then another thing you'll receive too is, again, the study questions. You've probably seen some practice questions come through, but we'll also give you sets each week with the knowledge level we're working on. And I will take this time just to hand off to Shauna for another introduction, which we appreciate.
Oh, all right. Yeah, I did want to call out Narita. She's part of our award. She's one of our award coordinators. She helped put that on this year. And Narita, do you want to tell us a little bit about yourself? Oh. All right. Well, she'll introduce herself in the chat and we'll go from there. Thank you.
Thank you. Okay, I'll do next slide here. So I think this is where you're all at today, is giving yourself that time to prepare for the exam. And this is a very reasonable timeline, 3 to 6 months. Some have used more, some have used less, but I would say, as we have all discussed our journey, we've averaged 6 months to get prepared. And that gives you the time to pace yourself as well. You'll see topics through this presentation, and this is why we are always so excited about presenting this, and why it was valuable for those that have taken this in the past. Is your role during this process, exam prep, is to evaluate your level of skill, knowledge, or competencies. It's not to overwhelm you with these topics, but it's to let you know where you may need to reach out to a mentor, where you may need to focus on that area. And there'll be abilities to do that through the American College of Healthcare Execs, through this link where you can actually assess your competencies. But more importantly, you're going to see topics through either the review questions or from the slide presentations, or which was done so beautifully through Rick's voiceover PowerPoints that you can then focus on and use that to set up your study plans. You may take one day or a half a day or part of your day when you study to stick to that knowledge base. Some of you are clinically focused and you're going to need to focus more on the business aspect or some of the regulatory pieces. Or if you haven't managed a full team or had a lot of HR experience, that will be important for you to look at that. And then just look at where your skill set is and then how you can easily transition that to other knowledge areas based on your background and your exposure. And that's where some of us come in too. We can be mentors for you in that. We're going to give you a plan, of course, in mentoring per resources that were provided in slide 10 and 11. And then these slide decks, both this slide deck and then the ones that you will receive as the voiceovers that you can review and use that. So I will hand this off to Michael.
Michael, we do not hear you.
I'm sorry for that. I'm sorry.
No worries.
So you have met all the requirements, submitted your advancement application, and gained ACHE approval for eligibility. Finally, you're ready to take the exam. So the exam is administered by the Pearson VUE at their testing centers across the country. You must register first for the exam and pay a $225 exam fee, or you can use the waiver if you have attended the BOG review course. After registration, you will receive a confirmation from the Pearson VUE with your testing date and time, venue, and your candidate number. So I would also advise you to arrive 30 minutes before your test time to complete necessary sign-in procedures. So as Sherry mentioned, the exam will take 6 hours, and once you're done with the exam and you submit all your answers, you will get the results right away.
And then Nora's going to take us to the last two slides. And we're giving you a brief overview of our presentation while she does that.
Okay, so this is our first technical glitch for today.
That's okay.
I'm so sorry. Okay, where are we?
Next slide, Nora, and
There we
you're
go.
doing well. Yes, thank you. Great.
You know, I had nightmares about this, but
You're doing great.
reading. Okay, so so ACHE does provide exam study sets that have, these are the most, this particular set right here for $295 is the series of 4 books with the most current versions. CAHL has a few sets of some of the older versions that are available for checkout once you've scheduled your exam and have an actual exam date. They're on first come, first served basis. I will send out, when I send out the information after this, I will let you know which editions we have. I think we have like the 5th edition of one and maybe the 7th edition of another. They're still valid. They're just a little older, but I will provide that as a resource when you let me know when your exam is scheduled, and I'll send those out to you. Then we also have, they've added another, this is the study bundle that includes the flashcards, which is the newest and greatest, and people are actually swearing by these. And I have a set that I've experimented on, and we'll, beginning with the next session next week, Michael and I will do a brief presentation. There's a digital version now through Quizlet where you can build your own tests. But people that have ordered these, and I wish I'd have had these way back in my day, but they swear by these. That, unfortunately, I am not able to check out because once you have to sign up for the Quizlet version, and each sign up only works for you. It's not something that we can pass on to others. But so again, these are available. I will send you a link with what I have or what the chapter has to be able to send out in a library system for checkout. So that concludes our general overview portion of this. I'm going to stop sharing my screen so that I can then go on to the next presentation, which actually is the healthcare knowledge area. And so bear with me.
And as we make that transition, I do want to just have a quick touch point and ask anyone if they have any additional questions. Again, the PowerPoint will be made available afterward along with the recording.
Okay, working on this. Hold on, please bear with me.
I also put in the chat multiple face-to-face opportunities because there's a series of virtual face-to-face credits at different chapters. They are cheaper if you go through the chapter versus trying to do a course for face-to-face credit on the actual ACHE website. Some are 15, some are 100. It just depends on the chapter. But that is much cheaper than what ACHE is offering, and those range from 500 to 700. I think even 900 at some point. So just look out for those and look at for other chapters as well.
Okay, bear with me again. My challenge is learning to share the screen at the same time that I'm in this.
I'll add, as Nora is getting us there, that in addition, again, today to the presentation we just saw, which was the introduction presentation, and then we'll do the knowledge level and some study questions, is we will be sending you a Survey Monkey. So your feedback is very important to us, as well as anything you can provide that would give us some good feedback for our next session. So
I am not able to share my screen, Sherry.
I have you as co-host and guest in when you pull up share screen
I'm not able to get to that option right now.
below on the bar below.
Hold on. You know what? Are you able to share yours?
I'll go ahead and do that then. I will get us into that.
I don't know
As
what
as Nora and Sherry figure out those technical issues, I am interested to see if anyone wants to take themselves off of mute and ask any additional questions as we have the opportunity in the space while we wait. No takers?
Are you able to see mine?
Yes, we are.
Okay,
Great.
Well, we'll go through the Board of Governor exam preparation knowledge areas. And this is also a good, as we've emphasized, spot for you to look at when you set up your exam preparation program. And today we are using the healthcare section. As you know, we've gone through the different knowledge areas that you'll need to learn about. But the knowledge of healthcare and medical terminology is in this portion. It's 28 questions, which is 14% of the exam. And that's why we like to start out with this one, because it gives you the overview. Again, Rick did a tremendous job in the voiceover PowerPoints to give us an overview as well. Healthcare trends, I mean, there's always ways to look at that if you are have subscriptions to virtual like Becker's or Fierce, to be able to speak and think about those healthcare trends when you're taking the exam and putting your study program together. The continuum of care is stressed through the program, as well as each individual entity along the healthcare journey, which again was brought out in Rick's presentation. How we provide care in our industry is important from a business perspective, and the textbooks and the guides that we're sending you are helpful, as well as doing your own research in that. It's about your comfort level to be able to recognize, as Michael described, how to take the test, about your knowledge. And I actually very much like to always review the types of healthcare providers in our industry or organization, profit, not-for-profit, federal, public health. There'll be a question surely on that, on the exam. And then it breaks it out to even ancillary services and how that supports our healthcare industry model and the work we do from a collaborative perspective. Knowledge of support services, and this is important as well. There'll be questions about budgets and so forth in the support service area. From this slide, is there anyone from the team that wants to add anything? The second part of the knowledge area for healthcare is interdisciplinary integration with and competition among healthcare sectors. And this is really critical as we talk about trends and our interdependency upon others, either as a competitor or as a colleague. You know, we have vertical relationships and different models within our industry on how we're interrelated. The clinical roles and qualifying criteria, it was emphasized about the licensure piece for clinicians on the slide presentation, so just become familiar with that. And a term we all use in terms of evidence-based practices, both from a clinical perspective, but a management perspective as well. Those are in the literature, in the research, and the nice thing about ACHE is, as a member, you are privy to the journals that are sent out with evidence-based practice management skills. So be familiar with that topic, that title, and what evidence-based practice means. Important concepts around staff and functional perspectives. Who does what role? And I like the way Rick said in the presentation is we're an autonomous group. We have kind of our functions within our roles, within our scope of practice, within our professional, but we also do work together and do that well. Knowledge of patient perspective. There'll be questions about how to make the patient more inclusive in the process, how patients now consumers and how well-versed they are and how educated they have become and how we need to include that in our plan of care for our patients and empower our patients to provide that level of communication. And then again, we've talked about it, the roles and interrelationships that need to occur for us to have success within quality, cost, resource allocation, continuity, and accountability, and then just working within our community. So those are the areas for you to be exploring in this particular session, and then I'm going to hand it off to Nora to start our first practice with study questions.
Yeah, our sample questions. And so Sherry, you don't mind handling the slideshow?
I will go next, yes, thank you.
All right. Okay, so first sample question is, which of the following is true about a capitated managed care organization arrangement? And as you answer this, the key word, one of the key words to look in here first is capitated. For those of you who are not familiar with that word, you'd think all of us would be, but if you're not, truly, this means per head. So, okay, we've got some people answering already. I see providers paid a set fee. Okay, and let's go down to answer. Oh, Sherry, can you go down? There you go. Providers paid a set fee. There you go. So the key, again, when you're looking at these questions, first of all, and you'll see this in other questions as well, usually the broadest answer is the best, and you've got to look at keywords in the question. Here it was, again, as one of the topics or one of the keys was to say, think of it as a true and false. So it's asking what is true. And then the next keyword is capitated. So yes, it's true for A. It's true that there's a shift in financial risk. Okay, it goes both ways. It all depends on what the agreement is on what financial risk is shifted where. But that's not the whole answer. Can the provider bill separately for each service provided? Again, it depends on the organization, but again, it's not the whole true story. Again, part C, the answer to part C, again, that is all a part of an arrangement that can be determined as part of the agreement, but the one that the key to all of this is that the providers paid a set fee. That's the capitated arrangement. What's within there, what makes up the fee is part of what A, B, and C helps determine.
Thank you, Nora. I'll go next. The cost of graduate medical education, GME, are of concern to the government policymakers because the number of residencies and residents are not centrally controlled, A. B, the number of medical school graduates exceeds the number of residency positions. C, managed care organizations are relatively uninvolved in the management of GME. And D, many residency positions are filled by foreign medical graduates. So we'll go back to the techniques that Nora described to us is let's really break out the question. So what you'll see first and what's most important is costs. So some of these others are comments or statements, but they're not about cost. And one very exciting part of the whole journey here is that I actually wasn't familiar with the term GME before I started. I did not work in an academic facility before, and you'll learn about that in your studies. But GME is really the residency and internship programs, and they're run exclusively separately at each location. UCSF has its own GME program. We had one at St. Mary's, UC Davis. So, and then when you look at this question further, concern to government policymakers. So we have to really look at who would be asking that question about cost. And so go ahead and answer this one in the chat if you want to practice. And then our answer is, whoops, sorry. Number A, the number of residency and residents are not centrally controlled. So there isn't a overarching government agency that tells UCSF or tells UC Davis how many residents or residencies or not they can offer. So it's an interesting question. Some of these are you know, do you see that this could be a bit subjective, but I think what you're really trying to do is just look at the question, what it's asking, costs and concern to government policymakers or payers. So I'll hand this off to Nora.
So again, the key, can you go back, Sherry, just really quick?
Sure.
Thank you. Okay, again, this is the broadest application of this, out of all the answers, this is the broadest, because the other B, C, and D are components of the fact that they're not centrally controlled. So usually the broadest interpretation of the broadest application is what works best. Later when we get into finance, that's a whole other issue, but we'll do finance next week. Okay, question 3, which of the following is a unit of measure commonly used to determine physicians' clinical productivity? Okay, and I see answers coming in. The key is, you know, healthcare is nothing but an alphabet soup of acronyms. So this is really important to understand acronyms. And funny story, Sherry and I were looking at, okay, CPU, wait, central processing unit, wait, that's IT. No, that doesn't belong here. So anyway, so RVU, relative value unit, key in there is value and relative. So, you know, so you're looking at a unit of measure, but what is it you're trying to measure? Well, it's clinical productivity, whether it's a physician's or, you know, nurses, but the whole key, it'll ask, you know, we're looking at relative values of something. B, CMS for Centers for Medicare and Medicaid Studies, IPA, which is Independent Practice Association, and again, the CPU, Central Processing Unit, which extends even beyond healthcare. Okay.
Okay.
The answer is, there it is. So I may have already given the answer away before we got there, but again, when you're looking at, yeah, you know, become familiar with as many acronyms as you can, because this, if this hadn't spelled it out, or it didn't spell it out. So, but those of you that chose A, you were correct.
Yay. So what population demographic factor is currently having the greatest impact on healthcare organizations? So again, as Nora has emphasized, it's the broadest component of the question, is what is having the greatest impact. So ethnic composition, insurance coverage, geographic distribution, and age cohort. So go ahead and answer this in the chat room. And we'll go with the answer. Age cohort. As we talk about this sort of has an impact on everything. Payers, has an impact on disease and disease management. Chronic disease management has an impact on the utilization of healthcare services an impact, and it's the biggest impact as we are aging, our baby boomers are aging, on the healthcare organizations as a whole. General question, super general question. So thank you. Next is Nora.
Okay, this is a very busy slide, very busy question. So again, the whole key is reading through it carefully. Public reporting of outcomes information has become a high priority for healthcare payers because, and again, public reporting of outcomes, a high priority for payers because measurements of performance have now become well established, standardized, and accepted by all parties. Purchasers are pressuring for disclosure of meaningful performance information for use by buyers and consumers. Consumers in healthcare are now well organized, and managed care organizations feel the need to satisfy them. And D, physicians are increasingly, where are we? Okay. Physicians are increasingly encouraging their patients to evaluate insurance plans based on publicly reported data. Okay, so after reading all of these, which ones do you believe is the correct response? Okay, I'm seeing some B's in there. Okay, next slide for the answer. And there it is, purchasers are pressuring for disclosure and meaningful performance information for use by buyers and consumers. So again, when you're looking at the question, for healthcare payers, okay, purchasers are healthcare payers. They could be insurance companies. Increasingly in my world, it's self-insured employers that are using the Aetna network or prior the Anthem network to manage their networks, but they're paying the claims. So they are asking for this information. I have to deal with this daily because they want this information, and so do consumers, but they're pressuring it for this kind of information. So the reporting function, when you look up at the question, it's the reporting function that's important, and purchasers are demanding it.
And Rick emphasized in the voiceover PowerPoint we sent out that it's really empowering the customer, empowering the consumer, and promoting communication. And Rick, anything you want to add on that concept?
Two things, just since I love talking health economics, I'll just mention, information asymmetry, and this is an attempt to overcome that. But more important, this is a good example of using the true false. So if you don't have to know a lot about it, you can eliminate 3 of them pretty easily. Are they well established? No. Are they accepted by all parties? No. So we can give that one a false. If you go to C, are consumers well organized? Not a chance. I mean, not in the slightest. Are physicians encouraging this? I don't think so. So even if you weren't sure about B, you can eliminate the other 3, and that's the one you're left with.
Thank you. Excellent topic and tips there. Thanks. I'll go to the next one. Health Savings Account, HSAs, were established through which law? And I do have to tell you, and I'm going to ask Rick to comment to it at the end of this particular slide, is they spend a fair amount of time both presenting, and they will ask you questions on healthcare law. They'll ask you historic questions about it, current questions. So it's very important as you set up your study guide. I did a grid, and I just put all the healthcare laws, all the major industry game changers, if you will, on specific laws or legislation or anything. And remember, this is the good part, is this is a national test. So the questions are asked from a federal perspective or from a national perspective. So you don't have to worry about individual state requirements per se. I mean, you may see some things that connect to your state laws, you know, specifically CESLA or some of the HR, but it's from the national perspective. So you're going to be looking at it from that perspective. So as you look at health savings accounts were established through which law, go ahead and try and answer that and send that in on the chat. Okay. Okay, the Medicare Prescription Drug Improvement and Monetization Act, modernization. So this act was brought forth in 2003 by President George Bush. So you're not going to need to know that level of detail, but you really do want to make a grid of those different things and what were the key factors that came out of those legislation or acts or government. This was actually part of the Medicare Prescription Drug Improvement and Monetization Act. This was the IRS code part of that. So it's very interesting to see how different correlations tie in. So Rick, please add anything you can about understanding about some of the acts and legislation.
Well, we said earlier this is supposed to be competency-based, that you don't have to memorize, but there are some things that you're just going to have to know what they are. And the contrast with the other one about capitation, you have to know how capitation works, not just what it means. In this one, you've got to have a sense of just what the law is. So I think I sent a list of all the laws. Did we send that out, or are we going to send that out when we get to laws?
We can certainly do that, yeah.
Yeah, okay, so we'll have kind of a cheat sheet of what each of the major healthcare laws will do.
We'll get that. Thank you, Rick. And Michael, you're the most recent Board of Governor exam in our group success story. So tell us what you did in this particular section.
I created a list of all the laws related to HR, to, you know, finance law. There's a separate laws from, mostly it's the HR law. I created a tabulation and just give a description of those law. Then how can I apply it in my daily activity or daily in my work, something like that. So that's what I did. That's how I learned or studied before about the laws. So it took me probably 5 or 6 pages of laws that I went through and studied. So it's just a tabulation that I did.
Thank you. Okay, Nora, take it away.
Okay. The most useful way for a healthcare organization to deal with outside regulatory and credentialing bodies is to, and of course, none of us have ever had to deal with outside regulatory and credentialing bodies, right? A, identify opportunities to influence political outcomes. B, regularly maintain both formal and informal relationships with these agencies. C, deal with these agencies only in written form, so as to have a clear paper trail for subsequent review and analysis. Or D, provide only the minimum amount of information required to comply with the regulations of the agency. Again, very busy question, lots of words, lots of opportunities. So again, so let's see, we've got some people answering. Okay, let's go ahead and go to the answer. Okay. Regularly maintain both formal and informal relationships with these agencies. Right away, there's a couple of ways to like break this or dissect this question down. Okay, we're talking most useful. Okay, so again, the broadest application that will be the most useful. Okay, to deal with outside bodies that are absolutely vital to how we operate. So when we look at these, we're seeing, yes, can identify opportunities, right? D, you can deal with these agencies, but see the key word there when you're looking at only in C and in D, only limits, it automatically is limiting something. So there's never any only way, you know, when you're talking about the most useful way. So, you know, that's the key right there. And in all your reading and in your daily work life, and as you read more about like in HR and in management, how important formal and informal relationships are. And so the key here is regularly and the formal and informal relationships. So I'm hoping that helps you understand how to pick that particular answer. If you're looking at all of these, it's like, well, yeah, kind of, but wait, only, no, there's got to be more than just one way. So again, when you're looking at the broadest application of this, the most useful way, by process of elimination, you can get to B. Sherry, Rick, can you?
Just having run a regulatory agency for 5 years, whenever people went to the politicians around me or over me, that just made me want to find more things they were doing.
There it is.
Thank you, Rick. We will remember that. Thanks. The principal advantage for inpatient and inpatient facility to affiliate with a geriatric care program is that such an arrangement provides for a continuation of care for patients A, B, permits patients to receive care in the home setting, C, requires less skilled personnel to provide the care, or D, is less costly to the patient. So go ahead and answer that in the chat, what you think. Okay, our answer is provides for a continuum of care for patients. And this you'll see a lot. And this is a concept that we have to always have part of our plan of care for a patient anyway, but it really does need to be stressed in the work we do, our affiliations with other organizations, and of course, programs like the bundled care payment, BPCI program, CMS's bundle payments for care improvement, all sorts of things we know from the Accountable Care Act, and what we do through our insurance and our payer sources with bundle payments, all requires us to have a good handle on managing care through the continuum. And that's stressed throughout your studies and through the presentations. Again, the principal advantage, like we've gone through each of these answers, some could be one advantage, but what you really want to know is look at the big picture. What is the best, and what is the principal advantage in terms of an arrangement? So an arrangement meaning how it will benefit both, right? So this is where we say take that time to answer questions and review questions and go through it like we're teaching. Go through, okay, this is asking what an arrangement, how it would be best for both. That way, when you get to your exam, you're really comfortable with looking at how the questions lined up and then what it might be asking from the words that are used. You'll recognize different. Anyone else want to add anything on this one?
Yes, Sherry, this is Michael. So related to the continuum, the word continuum. So take a look also, or be also consider the interplan of interplan IPOC interplan interdisciplinary plan of care. So it's because it's a broader plan of care. So look for that word also IPOC, interplan disciplinary of care, IPOC. They call it IPOC.
Perfect. Again, more abbreviations, but important.
Yeah.
Thank you,
Sherry, I do want to call out too, we have mentioned a few times emails that will be sent out. I believe you, Sherry, will be sending out additional information. No emails have been sent out as of right now, correct?
Nora, go ahead.
This particular presentation has not been sent out, nor has the general overview. Those will be going out shortly in the follow-up, as well as the information for the next session. So, and not to overburden you, the emails will come as, information from the 10-3 session and then another email. Sorry to blow up your inbox, but I think it'll make more sense to then have the next one say for the 10-10 session. Here's the links to the voice over PowerPoint, and I'll think of a couple of other things I know I need to send in there, but they'll come into two separate. So again, sorry to blow up your inbox, but I think that's the cleanest way to keep track of all this. And again, this is recorded, and oh yeah, I'll be providing the link to the recorded session.
Great.
All
And there's
right.
also a question for Michael to repeat the acronym he just used. Oh, there you go. IPOC.
just
Got
got
it. Thank you.
So this is a good time to bring up that Michael brings up. Okay, some of these sample questions are older. So these are from 2018. You know, again, the exam is updated, at least a quarter of it is updated every year. So after 4 years, you get a whole new exam. And there may be other sample questions out there that we don't have yet that have newer terms. And so again, thank you, Michael, for bringing that one in. So again, we might not have the most up-to-date in terms of the actual answer. What we're concentrating here on is how to help you interpret the questions, what to look for, how they're structured.
But in addition to that, Nora, but the continuum of care and interdisciplinary plan of care are to the same entity, so they just the same word, the same meaning. So
Correct.
Yeah.
just
So
different words.
yeah, no, agreed. Thank you for that.
This is your question now, Nora.
Okay. Your board of trustees has voted to terminate the privileges of a physician. Which of the following organizations must you inform? Ooh, yeah, talk about a minefield, right? But again, you've got to look at the broadest application, the broadest interpretation. Okay, and the most, so when you're looking at the broadest, okay, I'm seeing some answers come through. Okay, so can we go to the answer?
Sure.
Okay, there you go, National Practitioner Data Bank. For one thing, it's the law. I'm trying to remember what law it came in somewhere, Rick. You may be able to add to that. But again,
I think it's a healthcare improvement Act, something like that.
okay. And so here, this is national, the National Practitioner Data Bank. So this extends beyond the local medical society. There may be some requirements locally, okay, but at minimum, we know it needs to be national. Joint Commission, you know, Joint Commission is, granted it's standard, but it's not actually required, so that's kind of an elective thing. American Medical Association, that may be required for board certified, you know, but not everybody might not be registered with the AMA. So again, when you're looking at the broadest application, you're looking at National Practitioner Data Bank. This is the key words. Rick, have anything else to add?
Can I add something like that? Which is, when you see the word who must you inform, must sounds like a requirement to me. So I'm going to look at who can regulate me, who can tell me what to do. AMA can't tell me what to do. Local medical society definitely can't tell me what to do. Joint Commission, maybe if I'm accredited by them versus someone else, but then I'm left with National Practitioner Data Bank, which sounds like the right answer.
Thank you.
Eliminating the ones you can prove are wrong, and that'll bring your choices down.
All right, well, we'll move to our last study question for today. And effective facilities maintenance depends on, and again, this is good because you'll need to know about your ancillary department services, their goals, and what's most important for them. And facilities management is critical in the management of hospitals. Life cycle planning of equipment. And again, let's look at the word maintenance. An up-to-date inventory of equipment parts for the replacement. A periodic update of a preventative maintenance schedule. Or maintaining facilities on a preventative schedule. So let's put your answer in the database. I'm sorry, in the chat room. Okay, the answer is D. maintaining facilities on a preventative schedule. So this really talks about, when you talk about effective, what is going to, for the long term, keep facility and organization on track for maintaining the equipment, all the different HVACs, all the different components of facility management in a hospital. And anyone want to add from the group?
Again, the key here is when you're looking at what's the broadest application of all of these. Overall, you know, A, B, and C may be a component of a preventative schedule. I don't particularly like C at all because we're talking periodic, and you know, these have got to be ongoing, can't just be periodic. And we all know everything has to be updated, you know, in our department policies and procedures. But anyway, when you're looking at the broadest application of this.
Nora, one other thing on that one, which is having a schedule doesn't mean you're actually doing it.
I wanted to tie that in, the verb, in terms of doing it for maintaining versus the schedule. So good point. So that gives you the healthcare sample questions. We're going to have these in for each individual knowledge area. And Shauna, maybe this would be a good time to for us to do questions, if you think.
Yeah, we actually have been addressing the questions as they've been coming in. We did have a question about taking the test and if it was on hold due to COVID, but it looks like I just went on the website, and if you have your code from ACHE to take the test with your approval of meeting all the requirements, it looks like they are taking appointments. So you have to wear a mask and all that jazz, but it is available. And then for self-reporting credits for this session, you go into your My ACHE, and then you enter in your reported credits for that.
We determined this was on the honor roll, is that correct? On the honor system.
Yes.
Correct.
And then there was a question also, could you please define the healthcare volunteering experience required in the application process?
Pretty easy. Anything that you do within your scope, like within your organization or within your scope as a healthcare professional, would qualify there. In the past, I have used volunteering with the American Heart Association. And of course, using my experience volunteering on our CAHL chapter, which we're always looking for volunteers in all the committees. That's the community one's a little more challenging, but you can also, if you volunteer in several healthcare related things, activities that benefit your community, you can put those in there as well. And again, don't let me be the only arbiter of what would qualify. ACHE, the education department, or customer service in general, this is what they do. They live for answering questions like this.
Isn't the healthcare activity not necessarily volunteering, like even coming to the annual meeting?
You know, that's a very good
Healthcare
question.
activity, so yeah.
There you go. Yeah,
Makes
good
a
point.
difference.
And then the healthcare volunteer, I participated at the aid station for one of the fundraisers for our hospital. I think they want to really see how you can serve your community outside of your work. Also, volunteer. I was on the board at the Chamber of Commerce up in Mount Shasta when I was the chief nurse up there. And so they'll look at community involvement as well, as those are just a couple examples. Michael, what have been your recent examples?
My example is I volunteered as a board member and officer for the Clinical Laboratory Management Association Golden Gate chapter. So that was my volunteer.
Yeah, and then on the ACHE website, I did put the link for more clarity on that, but the community and civic activities that they listed as examples as well, some include coaching a sports team, involved in local 4-H team. So it doesn't necessarily need to be involved in healthcare specifically. That's where the healthcare related activities come into play.
So Arnaldo, you may remember this from our on-site in-person sessions, but my favorite story is I was a band booster for my kids in high school band. I was the uniform mom, and you know, that worked. I was able to use that as my community and civic volunteer.
Yeah, and there's a question, would volunteer time with a school committee for my daughter's high school count as a community activity? And I would say yes.
Yes. Absolutely.
Yep.
And again, you're welcome to call ACHE anytime you have any questions about that, and they'd be able to help you determine if that qualifies.
For community, I volunteer at the Open Kitchen to, you know, serve food. So that's a community volunteer. So
there it is.
Great. And then we have a question about the exam being timed. Just clarifying if it's timed per question or if it's the whole session.
it's the whole session.
Okay, great.
So Michael, if you can spend just a couple minutes, we're running really short, but
so the 6 hours is a whole session. If you are smart enough and you know you can answer the question, all the questions in 3 hours, you can submit your questions and get your result right away. However, you know, it's timed 6 hours, and you have the flexibility actually to take a break, 15 minutes. You're entitled for 2 15-minute break. So, but they will only allow you to stay in a certain location, so that, you know, then you can just stretch out and just reset or refocus yourself.
Wonderful. Well, we have 4 more minutes. Is there any other last minute questions anybody wants to take themselves off of mute and ask, or ask in the chat?
so I will go ahead and say that you have my email address, everyone. You can send me questions as well. And I will answer the best I can. A lot of answers you can get through the ACHE site. I will be sending out our overview presentation. The links are fabulous. They really are helpful. In our closing session, we're going to go over some of the detail about where you can go and get answers and get additional information.
And then just to let you know, because we're introducing new tools at each session. So next week, stay tuned. Nora is going to do Quizlet, and it's pretty exciting, and it will show you sort of another really rich opportunity that will allow you, if you purchase the flashcards, you can get a Quizlet subscription, and she'll give us the details on that. And because, as we've said, the more you do with practicing exam questions, the more innate knowledge you'll have, and the more comfortable skills you'll have with the exam itself. So she's going to teach you about that. We're also going to, next week, we appreciate people's using the chat room. That's really valuable for us for answering questions. We're going to introduce polling as a ability to answer those questions, so we can see how many answered what question. And as a reminder, we will be sending out the next voiceover PowerPoint presentation for next week's, which will be finance, which is 12% of the exam with 24 questions, and HR, which is 22 questions and 11% of the exam. So next week's session will be an hour and a half devoted to those 2 topics, and using the polling feature, and then introducing you to Quizlet. The following week, Michael will be doing management and business. And then 1024, Richard will be doing professional ethics, laws and regulations, and governance. And then we'll close on a Halloween session with IT. That's perfect for me, Halloween session with IT, and then quality. and then take questions or have everybody engaged in that last session, that last Saturday on 10/21. So I don't think we can thank you all enough, those that have been part of this presentation today and those that are participating with us, to let you know how much we appreciate you. I counted 40 participants, and Nora and Rick, you've been doing this a long time. Have you ever had 40 participants in a review session?
I think so.
No. No.
Okay, so we are pleased to be able to do that. And then any last minute comments before we close to participants?
This is Michael. Just you know, as a perspective from from a person who just took the exam, the textbook on the well-managed healthcare organization by Griffith really helped me a lot to understand the healthcare area of the exam. So just consider probably going through that book, because it really added a lot of value in me when I took the exam.
Thank you. All right, well, I think, Shauna, if we could close to participants.